What's up, guys? Kenneth here, and today we're talking about hydration. Why, how, and when. Why hydrate? There are several reasons you need to stay hydrated during activity. First, transportation. The average adult male is made up of about 60% water. Water in the body helps transport nutrients and remove waste. Blood is 75% water, and nutrients like carbohydrates, lipids, and proteins are transported to different areas of the body through the blood. Waste products are excreted, and water helps in this process. Additionally, water helps protect the body against foreign invaders by creating mucus, which is 90% water. Mucus helps rid the body of pathogens and nasal irritants. Second, thermoregulation, the balance of heat gain and loss in the body. Water works to store heat in the body and keep core temperature constant at 98.6 degrees Fahrenheit. When the body gets too hot, the hypothalamus in the brain, or the control center for temperature, sends a message to muscles to dilate. Sweat is the body releasing heat in an attempt to cool off, much like opening the window on a sunny day. When it's cold out, the hypothalamus sends the message to the muscles to constrict in order to maintain heat. Third, water balance. Every day you lose water, sometimes without even thinking about it. When you exhale or sweat, you lose water. When you urinate, you lose water. In order to stay balanced, match water output with water input. Too much output and not enough input leads to dehydration. Dehydration is often the gateway to more serious problems such as muscle cramps, exertional heat exhaustion, and ultimately heat stroke. How do I know when to drink? There are several ways to measure hydration levels in the body, ranging in complexity and practicality. Weight, urine color, and urine-specific gravity testing are three options. Weight. Because weight can change depending on the time of day, timing of meals, relative to exercise, and calories burned during exercise, it's important to compare post-exercise weight to a relative standard. You do this by following a simple formula. Pre-exercise weight minus post-exercise weight divided by pre-exercise body weight times 100. A simpler, less exact method is pre-exercise weight minus post-exercise weight. Athletes should measure themselves at least before and after exercise and during when available. Weights within 1 pound are well hydrated, -1 to 3 minimal dehydration, -3 to 5 significant, and greater than 5 serious dehydration. A greater than 2% decrease in body weight indicates that athletes are dehydrated and need more water during the event. Urine color. A urine color chart is a simple way to gauge hydration status. Higher numbers indicate darker urine. Darker urine indicates a greater degree of dehydration. 1 to 2 is well hydrated, 3 to 4 minimal dehydration, 5 to 6 significant, and greater than 6 serious. Measure this before exercise. Urine-specific gravity. While extremely accurate, this method involves taking a sample of urine and looking at the volume of water in the urine, which may be difficult to do before practice or game situations. Hydration strategy. There are many steps athletes can take to maintain hydration levels during activity. The National Athletic Trainers Association lists 18 of them, and I'd like to go over 10 of those steps. First, establish individual hydration protocols. Hydration needs vary depending upon sweat rates, sport dynamics, environmental demands, exercise duration, and intensity. Second, know your sweat rate. An easy way to calculate this is to have one 1-hour practice session for all athletes without breaks or for hydration or bathroom use. Measure athletes before and after exercise. Take your pre-exercise weight and subtract your post-exercise weight and you get your sweat rate. This can vary between 0.5 liters and 2.5 liters for individuals. Third, flavor liquids to preference. Fourth, pre-exercise, consume 500 to 600 milliliters or 17 to 20 ounces 2 to 3 hours before exercise, and 200 to 300 milliliters or 7 to 10 ounces 10 to 20 minutes before exercise. During exercise, consume 7 to 10 ounces every 10 to 20 minutes based on need. Maintain less than 2% body weight reduction. Individual needs vary based on sweat rate, sport, and tolerance. Post-exercise, drink beverages containing water, carbohydrates to replenish glycogen storage, and electrolytes to speed rehydration. 7. Beverage temperature between 50 to 59 degrees Fahrenheit. 8. Use sport drinks containing carbohydrates if exercise is more than 1 hour long or intense. 1 liter of a 6 to 8% carbohydrate solution per hour of exercise or 1 gram per minute. 9. Recognize the signs of dehydration: thirst, irritability, discomfort followed by headaches, dizziness, cramps, chills, vomit, and decreased performance. 10. Have a plan in place in case of emergency dehydration situations. Emergency planning. Because many of you will train in extremely hot environments, it's important to know how to recognize, prevent, and treat exertional heat loss illnesses. Recognize: muscle cramps, cramps, localized pain, dehydration, thirst, sweating, fatigue, and usually less than 5 minutes in duration. Heat syncope: brief fainting, dizziness, tunnel vision, pale sweaty skin, decreased pulse. Exertional heat exhaustion: excessive fatigue, fainting, collapsing, hallucinations, confusion, altered mental status, and the rectal temperature less than 105 degrees Fahrenheit core temperature. Exertional heat stroke: core body temperature greater than 105 degrees Fahrenheit, patient will often collapse, and central nervous system dysfunction. Prevention: gradually acclimate to heat over 7 to 14 days, increase intensity and duration slowly. The most dangerous time is the preseason workouts, often 7 to 14 days before acclimatization. Athletes with viral infections should not participate in practice. Keep hydrated. Avoid 2% body loss weight. Keep urine light in color. Have emergency plans in place. Teach all coaches to recognize and prevent exertional heat illnesses and stroke. Have medical care available. Athletic trainers reserve the right to pull players from practice. Refer to doctors if needed. Cold water or ice tub available to immerse patients if exertional heat illness or stroke is expected. Rectal temperatures are the clinical gold standard for attaining core body temperatures for individuals with exertional heat illness. Sleep at least 7 hours a night in cool environments, eat a balanced diet, and have proper hydration. Rest times between 2 to 3 hours per sessions allow for recovery. Preseason policy develops to help deal with the heat, and hot days shorten activity or reschedule. Individuals susceptible to exertional heat illness should be identified. Rest breaks planned. Work-to-rest ratios match intensity of activity. A cooling zone, shade, fluid, and time to take off equipment when needed. Treatment. Muscle cramps. Rest, passive and active stretching, ice, massage, or often both. Electrolyte beverage, along with food or sodium replacement. Heat syncope. Move to a shaded area. Monitor vital signs, elevate the legs, cool the skin, and rehydrate. Exertional heat exhaustion. Remove excess clothing, move to a shaded or cool area, use towels and ice. Legs should be elevated above heart level. If no improvement happens, intravenous fluids and transfer to the physician may be necessary. Exertional heat stroke. Lower core body temp to less than 102 degrees Fahrenheit within 30 minutes of collapsing. Body cooling lowers core temp and return blood from skin to heart. Immerse in a cool tub. Monitor rectal temp every 5 to 10 minutes. Cold water immersion up to neck is the most effective. The patient should be removed when core body temperature reaches 102 degrees Fahrenheit. Cool 1 degrees Fahrenheit every 3 minutes. And then cool first and transport to emergency medical technician second. And treatment should happen within 30 minutes of initial signs and symptoms.